Hi, good morning. I am Dr. J. Surendran, Senior Consultant Radiation Oncologist, Dr. Kamakshi Memorial Hospital. Today, we will speak on the role of radiation in cancer management. Generally, cancer management is by three modalities. Surgery is the main modality. The second is radiotherapy. These two are local modalities of treatment. The third is the chemotherapy, which is a systemic way of approaching cancer. Radiotherapy, as such, addresses about more than 50% of any cancer patients that comes for treatment during the course of the disease. This era, the 21st century, is the era of advanced radiotherapy. Advanced radiotherapy means that what has been not reached earlier is reached now. In other words, radiotherapy from time immemorial was towards safety and efficacy of radiation delivery to the patient. Radiation, by and large, is of two categories. One is external beam radiotherapy, which is delivered by the linear accelerator. And those that we have now all over the world, particularly in developed countries and in chief metros, we have the highest end of linear accelerators which are catering to advanced radiotherapy management. The second category is the brachytherapy. Brachytherapy is a form of radiation where the isotope is placed inside the tumor to deliver radiation. So these are the two broad kind of radiation therapy. In our hospital, we have got the latest and advanced form of radiation, which is offered as VMAT, SBRT, SRT, and SRS. These are offered again in three categories. First is they are used primarily to treat cancers, mostly in the brain and in the head and neck region, particularly in the laryngeal cancer situation. Thirdly, it is used for lung cancers, prostate cancers, cervix cancers, and so on. When we use it as a primary treatment, these are the sites of main treatment. The second is an adjuvant type of radiotherapy, where radiotherapy is given for certain clinical situations which are prognostically significant after surgery. It can be in the head and neck region after surgery. It can be in the thorax region after operation of breast cancer. It can be in the pelvic region after the operation of a rectal cancer. Cancer as such is of broadly of two types. One is the solid tumors and another is the hematological type of tumor. I am mainly, or the radiation aspect is mainly concerned on treating the solid tumors. Now, what would be the safety and efficacy and the curability of this advanced radiotherapy is? They are used to treat small tumors primarily in the brain, in the head and neck region, in the lung, in the prostate, in the cervix by higher doses of radiation for a very short time by a technique called stereotactic solutions with image guided radiotherapy. These are very two important latest advancement in radiotherapy which we have in our institute to offer not only cure to small tumors, primary tumors, but also in the event of smaller recurrence, in particularly in the lung and liver, when they recur in very small size. So there is always a second chance of cure in patients, particularly those with breast, those with prostate, those with endometrial carcinoma or ovarian carcinoma or colorectal carcinomas who are primarily cured by surgery, radiotherapy, and chemotherapy. And during their follow-up for the next 5 to 10 years, when they recur as in a small level or in a small volume, and if we detect it early, we can always cure it for the second time and proceed on to a better way of life. So this radiation as such is not as simple as the other two modalities. It has to be anchored in the hospital with appropriate protection, radiation protection and radiation safety affairs. We are under the direct survey of national and international agencies. The national agencies, for examples, are the BARC and the ARB, which are monitoring us as to the safety and deliverability of radiation. Then is the component of technology and software which you employ to deliver this kind of radiation. Radiotherapy is primarily a computational type of treatment, and we treat it based on several algorithms, and primarily we are image based or image guided form of multi-step radiation process. In this process, we mainly are concerned with the images we acquire from the brain, from the head and neck, from the lung, from the abdomen and thorax, where the tumor is situated, and we feed it into the computer and make their spatio-temporal localization and precisely and accurately point out the radiation towards the tumor base or the tumor center, passing through the various trajectories in the human body to reach it, so that we give as high as dose in a very short time, in a very short period of time to the tumor, and very less to the adjacent structures, so that the toxicity profile, the long term, which is the most problematic issue in radiotherapy, the long-term morbidity is much reduced with the commencement of advanced radiotherapy, namely the VMRT, SBRT, SRS, and stereotactic solutions. Thank you.